Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com. Aloha, Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juleff of the Vein Clinics of Hawaii.
Well, hello there, and thank you so much for electing to spend some time with us. Are we going to completely cure you of venous disease? I wish we could say yes, but that'd be a lie. But we can help you, and we do that every single week, and we're so glad that you're here this week. If you've been here before, that's one thing. We heard the phone number a minute ago. Today, you just want to go to the website, and I'm going to tell you more about that as the day goes on, as the weeks go on, because they're spending a lot of effort making it so user-friendly, and so many things that are covered that give you an insight into venous conditions and what you can expect in diagnosis and treatment. It's just a great way to start the conversation at veinclinicsofhawaii.com. Okay, as you know, most of the time, those of you that have been with us for a long time, we have usually specific topics that we zero in on. Sometimes it's, sometimes it's deep vein thrombosis, DVTs. Sometimes it's spider veins. Sometimes it's varicose veins. And sometimes it's it's always themed. Today, we have one of our lovely question shows. These questions come from all over. So today's program, instead of calling it Vein Surgery Day, we're calling it 20 Questions, Give or Take.
Right. Yeah. Plus or minus.
Plus or minus. And it is amazing to me, no matter how long we've been doing this, the amount of people that are still out there that really have no idea what varicose veins are, or what vein problems are. Mm-hmm. And so many people, if they just listen to their body and they learn what we're about to talk about, they're going to think, hey, that's me.
Yeah.
And it's time, I got to go somewhere.
Right. Well, like you opened the show with, are we going to cure you of your venous disease? No, but, I think more importantly, we are hopefully going to get people who have it to recognize it, because
exactly.
So many people have this problem of, venous functional problems in their legs, and they don't know it because it's not obvious. But because the spectrum of symptoms is so wide, some people just have varicose veins, and one first question, what are varicose veins? And I think that varicose veins is just one symptom or sign of the bigger picture, and I like to point this out to people all the time, because not only do lay people, because most lay people don't know all the intricacies of the process, but even advertising and even insurance companies, they refer to this
decision makers.
Yeah, exactly. They refer to this whole problem as varicose veins, and it's varicose veins doesn't really encompass all of what is going on. The underlying disease process is something that we call venous insufficiency, and venous insufficiency has to do with functional problems of the veins in our legs. Mm-hmm. Do we have veins in other parts of our body? For sure. Can things go wrong there? Yeah, but the veins in our legs,
pretty much a leg deal.
Yeah, they have a special function, and they have a special set of things that they have to a specific set of demands on those veins in our legs that other parts of our body don't see.
You're gonna love this one. I got a friend that says, I listen to you guys' show, and I don't think I have vein disease, but I have a lot of problems with my arteries. These are the big ones on my arms.
Yeah. Well,
those aren't arteries.
Yeah, that's the other hurdle that we have to get over sometimes is just defining what's an artery and what's a vein and what's the difference between the two. And I think that's one of the questions in our question set today. So we won't answer that yet. But so the bigger problem is something that we call venous insufficiency, and varicose veins are just one of the signs and symptoms of a whole bunch of different signs and symptoms that people might have when they have venous insufficiency. Now, on the other hand, there are plenty of people out there who have significant venous insufficiency, but they don't have varicose veins. There's a number of people out there that have significant venous insufficiency, and they might be having significant symptoms from venous insufficiency, but their legs superficially look perfectly normal. So, you have to keep that in mind, too. So, and that's why we always, I always try to, go through the litany of symptoms. And again, we'll cover that at some point throughout the hour here today. But it's not just a problem of varicose veins.
Yeah, and that is of all interest to me because, and by the way, everybody is, I don't want to say flirting with it, but everybody pretty much has a shot at it. But what you say is interesting because what you're talking about, problems that might be going on inside that don't manifest visually. So they, for years, are either unchecked or misunderstood or not even thought about.
Right. Yeah. Absolutely. And there are some medical risk issues for people with venous insufficiency. So if you have the symptoms that we're talking about, it is always beneficial for you to have it evaluated, and then you and your doctor can decide whether it needs to be addressed or not therapeutically. So what causes varicose veins? Well, what causes varicose veins, again, is this underlying thing that we call venous insufficiency. So what is venous insufficiency? Well, venous insufficiency is the abnormal function of the veins in our legs, and that has to do with failure of one-way valves. The veins all over our body are the blood vessels that carry blood back to the heart, as opposed to the arteries that carry blood from the heart. But veins get blood back to the heart. So veins in our legs should be consistently moving blood upward on its way back to the heart. It has to overcome the force of gravity. I mean, when we're standing upright, gravity is actually pulling that blood down.
Look like a waterfall.
Yeah, exactly. And so the things, there's a few different things that allow for blood movement upward in our legs, even when we're standing. But probably the most important of those is the presence of tiny little one-way valves. And there's many little one-way valves that are inside of veins that keep the blood moving upward. So when we say one-way valve, we mean that it's a little piece of tissue that allows the blood to go up, and then it stops it. It's an impediment to blood going back down. And what happens in venous insufficiency and in varicose veins is that you have the propensity for those valves to fail. Usually it's a genetic thing, and we'll talk about that in a second. But as those valves fail, the blood starts to settle downward into the leg. And the veins in our legs can carry or hold a variable volume of blood. Our arteries are not so much that way. Our arteries, the blood is...
Here it comes.
Yeah, right. The blood is being propelled. It's on a highway, and it's going to get to wherever it's going to go. Whereas the valves or the veins are, that's sort of the scenic route back to the to the heart, and it's going if the blood wants to stop and linger at an overlook scenic area, it's going to.
That always brings to mind for me, and I get some of these questions, is how far apart are the valves? I mean, do they start?
Yeah.
Are they every 2 inches, 3 inches, or does it vary?
It's variable, but typically, for instance, in the great saphenous vein, it's about every foot or so. And they're just tiny, tiny little pieces of tissue. It's amazing how mechanically wonderful they are for being so small and kind of simple. But they're just so very important with in keeping the blood moving in the right direction. And like I said, that's the basic functional problem is those valves failing.
With all the improvements that have been made in the diagnostics and treatment, someday they're not available yet, but someday somebody is going to, I don't know, it might be the Juleff or the Buck or the Smith, somebody's going to make a valve.
Yeah.
I know they're working. People have to be working on it.
Oh, yeah. Well, and there are... there are surgical procedures that are out there that where we can correct the valve function in the deep venous system, not the superficial, but the deep.
Because they're bigger?
Because they're bigger, yeah. It's a little more, mechanically you're able to do it. But still, those operations are often not successful, fraught with complications, and, sometimes not terribly reliable. So we reserve those types of operations for people with very, very severe venous disease. But yeah, you're right. At some point in the future, we're going to have probably a percutaneous placement of a synthetic valve that the body will be able to function along with. And
but until then, we have veinclinicsofhawaii.com. Don't forget about that. Very important.
Yeah. So, question number 3, what are the risk factors for developing varicose veins or / venous insufficiency, since we kind of use that term interchangeably. But, probably first and foremost, like I said, genetics is the biggest role. So, most people, they come into the office and I say, gee, did your mother, your father have, vein issues? And, most of the time they say, yeah, well, my, father had, and I say, well, yeah, you can send them a thank you note if you can. So that in what you're inheriting from parents and grandparents is that propensity for those valves to fail. It has to do with the fact that the vein, there's a problem, there's a molecular problem with the vein wall, and the wall, starts to dilate, it loses its elasticity, and as the vein dilates, then the valves, the valve leaflets, as we call them, pull apart, and the valve starts to fail. So that's basically what happens, and usually it's something that we inherit from parents and grandparents, and it goes up tremendously. If you have one parent that has venous disease, the likelihood that you will have some amount of venous disease is about 60%.
Let me ask you this. Do you think that someday there's going to be sort of upon birth or shortly thereafter, it is noted somewhere that you need to watch out, you're only 5 or 3 or whatever you are, but you're going to have the probability of vein issues?
Yeah. Very likely. I mean, we have that kind of genetic mapping now.
Sure.
And actually some of these commercial, the 23andMe and
the Ancestry, a lot of these guys, right?
Yeah, they do that. They do. They evaluate your DNA for those markers that may show a higher likelihood of developing one disease process or another.
I think that's terrific.
In some cases it is. In other cases, I just do not know. But
well, I know that there's been lots of studies on dementia, and sometimes it passes one, it hops over one, but that does not is probably not the case with veins. I mean, they are what they are. But it's not as though you want to blame anybody.
No.
But if we could just say, okay, well, Doc, give me a list of the causes and reasons, and I'll stop doing all that stuff.
Yeah. Well, yeah, and there are things that we can, do something about with respect to our lifestyle, et cetera. But, unfortunately, genetics is not one of them. But, I think, in the future, we're probably going to be a much more adept at evaluating DNA and figuring out, what disease processes any particular person may have a higher likelihood of having in the future, for sure. But so the second risk factor is age. As we get older, the more the likelihood of having venous disease goes up, and I think age. It's not necessarily that you're old. It's just the fact that. The timeline is moving along, and if you have the genetic predisposition of developing these vein functional problems that we see, then the longer you live, the longer that's going on, and the longer that the higher the likelihood that veins in your legs are going to succumb to that genetic influence. So. The next thing is female gender. Now, I will say that, typically we talk about vein disease as being more common in women. But I got to tell you, we see a lot of men.
Yeah, and gang, I've said that from the beginning, because not only, as you know, I'm not only the host of the show, but I'm a patient. So I have reason to go on a regular basis to the doc's office, the Vein Clinics of Hawaii here in Honolulu, a lot. And although and you can explain physiologically why, particularly during pregnancies and other things, why women probably are a little bit more at risk. But I'm seeing 50-50.
Yeah.
Maybe it's just awareness, and maybe as people get old, guys get older, and that they start getting impacted, they can't do it. Men, you're going to correct me. I know I'm going to be wrong here, but I'm not sure that men are as conscious vanity-wise about what they look like.
Yeah, for the most, in general.
Yeah.
However,
I
would say that's
when they
true.
start looking really ugly, then they do get worried.
Yeah.
Like, I can't go play tennis anymore because of this thing on the back of my leg that follows me around.
Yeah.
You're getting huge.
Yeah. Well, I think, men are not as prone to, react to the aesthetic side of it. Number one. Number two, men seem to come in a little later in the process. Things have to be a little worse for them than for women. And I think that's just across the board. That's the way men are. But
let me tell you why I heard this during this COVID time we're living in. Women especially, and some men spend a lot of money on things like makeup and appearance. But now, because you're covered up most of the time, they're looking at spider veins and some of the other things.
Sure.
Because if you can't see somebody's face, you look somewhere else.
Yeah, exactly.
So that's what's happening. People are looking at people's legs and say, "What are those ugly things hanging on your legs?"
Yeah. So
that's why it's Vein Clinics of Hawaii. If you want to get them treated, a little plug there.
Yeah. So anyway, well, you're right. As far as it being a little more common in women, pregnancy plays a major role there, and we find that in women, multiple pregnancies is a risk factor. The more children you have, the more likely you might have it, and that's for a number of reasons, mechanical. When you go through a pregnancy, the uterus is getting getting huge, and it's compressing the pelvic veins, and that's going to affect then the downstream function of the other veins in our legs. There are hormonal changes that happen during pregnancy that
we men don't have quite as many, if any,
lead to relaxation of blood vessel walls, and there's an increase in blood volume that the veins have to contend with. So there are hormonal changes that occur with each pregnancy, and then there's hormonal changes that occur during menopause, that type of thing. So, there's those influences in women that make it a little more likely. Typically what I'd say is that for the most part in this country at least, 50% of women by the time they're 50 have some amount of venous insufficiency. So, that's a pretty good size.
So it would seem that their percentages are higher than the male's percentage.
It's a little higher, yeah. On the other hand, there are other influences in men, that may cause it to progress. Again, if you have the genetic predisposition.
Let me give you one of them: obesity.
Obesity is definitely a risk factor, and that's actually the next one on the list.
Yeah, been there, done that. That's why I was hoping to pop that in, only because it simply means what steps can you take? And these are some of the questions that come up a lot.
Yeah.
Is that how can you be proactive? You don't just wait to go to Dr. Juleff's office and get veins fixed every time you need them to get fixed. You got to do some stuff too.
Yeah. That brings up the point of, what can we do? What can the patient change with respect to their lifestyle that may impact the progression of venous disease. Unfortunately, it's not as straightforward as arterial disease. In arterial disease, what happens there is that there's a buildup of plaque inside the artery, and we know what leads to that plaquing, or the propensity to form plaquing. And so in diabetics, if they control their blood sugar, if people control their weight, a certain amount of it is fat intake, and things like that, exercise. All of those things can impact the progression of arterial disease. Unfortunately, there's not a lot that people can do to impact the progression of venous disease, but one of them is weight. One of them is weight loss in a person who's obese, who has venous insufficiency. That is one of the things that we can change. Unfortunately, it takes so long for that to change over time that what we end up doing is we end up treating their venous disease and treat their obesity at the same time. But that's something that they need to think about when they're very, very young.
And by the way, gang, that's one of the things that I do in my other life. Is I'm often speaking at weight management programs and things because of my success in battling and being somewhat victorious over obesity. There are some things that happen to people that have a condition for a long time that no matter what they do, when they get the condition handled or fixed or they change it, they are stuck with long-term effects of it. And isn't it true, too, that some of these measures you're talking about, the quicker you get them, we're talking about getting rid of decades of discomfort by making some really smart decisions in your 30s or 40s instead of your 60s or 70s.
Right. Yeah, we're even younger, So that's one of the things that people can do something to impact their risk. And then with respect to obesity, the other thing that kind of goes hand in hand with that is something called lymphedema. And lymphedema not only goes hand in hand with obesity, but also goes hand in hand with venous insufficiency. Unfortunately, again, once that's in place, it's really hard to kind of reverse it, and you're left with doing the mechanical things that we can to sort of counteract that. And then the other risk factor is hobbies and professions that people are involved with that necessitate them to be on their feet for long periods of time throughout the day. We see a lot of people who are, hairdressers, teachers, a good number of pharmacists, nurses, retail people.
I met a guy who was a listener of our program. Who's a postman.
Right.
And recently he had to go do a different route because he could no longer do the foot part of the route. Now, a lot of these guys, you think, and gals, they're just driving around the little truck and they stick in your mailbox.
Yeah.
Some of these people will park their truck and walk a quarter of a mile with a bag full of stuff.
Yeah.
And this guy's ability to work was impacted because of legs, because of huge venous insufficiency.
Yeah. It can be that bad.
Yeah.
It can be that bad for sure. I think, that kind of falls under the category of if you have been in that kind of profession, and if you don't have something that's obviously venous insufficiency, like varicose veins, you may be having symptoms of venous insufficiency and you don't know it. So, if your legs are heavy, achy, tired, swelling, muscle cramping, this guy was, he lacked, he had, easy fatigability or early fatigability. His legs just fatigued much quicker than they used to. And so, again, that can be a symptom of circulation, but in particular, venous insufficiency. So anyway, although we see all those professions in our patients. So why do varicose veins occur more in the legs? And we get that question, all the time. People will come in with dilated arm and hand veins, and in some people, especially older ladies, they don't like the appearance of hand veins because it makes their hands look older.
And what's funny, because the weightlifters, they love those big popping out veins on their arms and chest.
Right, exactly. Yeah, I've talked before about a couple weightlifters that we have treated, and and you can, when you're looking at somebody like that, when you're looking at their legs, for instance, there's a difference between a normal dilated vein and an abnormal dilated vein.
Sure.
So,
well, that's good to know. In other words, if you pumped one up,
yeah,
it's not going to stay that way necessarily.
Right. Yeah. So, I can remember when we were treating this guy, he wanted to keep some of his veins. He didn't want us to get rid of all of them. So we had to kind of mark the ones we were going to get rid of. And
X marks the spot.
Yeah. So, but the, with respect to veins in other parts of our body, like our arms, is the same, pathology going on? No. Because the pathology that we see in the legs having to do with valvular failure and blood going in the wrong direction, we just don't see that in the arms because the arms don't need as much that the function of the one-way valves. The arms are not as exposed to the hydrostatic pressure that we see in the veins in our legs, especially when we're standing upright and all that blood, that pressure, the column, that fluid column of pressure that's being transmitted all the way down into our legs. We don't see that in our arms. Typically the blood in the veins in our arms just drain back into our heart, in a much easier fashion. So that's the reason why we see varicose veins and the repercussions of venous insufficiency much more commonly in our legs because our leg veins rely so heavily on those one-way valves and also the muscular activity of the calf, something that we call the calf muscle pump. So typically, no, the answer to that question is we don't see varicose veins in other parts of our body. But no, I take that back. There are some situations, where our internal veins, in the pelvis, in the lower abdomen, sometimes those can be dilated, and they actually can become symptomatic for very similar reasons. Yeah. We've talked about something called pelvic congestion syndrome before, and it's a complicated topic and not something that can be covered quickly. But for instance, pelvic congestion syndrome has to do with abnormal function of the veins in the pelvis of women, and it has to do with the veins that come down and surround the pelvic organs, and they can become dysfunctional for the same reason. Valves fail, and the blood starts to settle downward. It doesn't move upward in the direction that it should be going, and that the dilatation and the reservoir effect of blood in those veins in the pelvis can create, fairly severe symptoms. So that would be one other situation where varicose veins, other than the legs, but by and large, with respect to external veins, varicose veins and venous insufficiency is primarily a problem of the legs.
Okay, gang, if you want to get added to the number, And if you want a question answered yourself someday, I would go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com. And I do that rather quickly if I were you. And one of the things that's going to come up, and I know this for a fact, that happens a lot, and even though it's not on the face part of this list, Doc, that you gave me, I do have a question about people that are disabled or are not able to get around and maybe not paying as much attention to venous insufficiency because they're not able to either feel their legs or they just don't use them because they're, say, in a wheelchair. I know you see patients that are like that. How if any differently are they treated depending on their ability or their mobility?
Yeah. That is actually a very, very good question because we do see those types of people periodically, and when we see those people, it's so evident how important the normal physiology is, especially as it pertains to the calf muscle pump. Because the calf muscle pump fails for a couple of different reasons. Number one, if the valves fail, that can become less effective. But also, if the muscle is not contracting, then the calf muscle pump is not effective in any way, shape, or form. And we will see those types of people, either people that have neurologic disease of one sort or another, or they've had a stroke. And we've seen a number of those people who have had a stroke, so one side of their body may still be paralyzed from that stroke. And so they may have a substantially more amount of symptoms and swelling and that kind of thing in that immobile extremity. I do know that there are devices and there's stuff that you can do now that was maybe not available before. Because usually didn't mean when somebody was relegated to a wheelchair that their clock started ticking. I mean, if that's where you are, you're not going to get better. Right. But from what I understand, you can I don't want to say increase the the condition, but you certainly give them a better quality of life. By doing by helping them. Right. And that sitting in a wheelchair, I mean, that kind of compounds the problem because the leg is hanging down all day long. And often a lot of times those people who have medical problems, they have problem with mobility, and the family has a hard time getting them, from one place to another. Often they're sleeping also in a reclined, not flat in bed, but like in a recliner or whatever, and that also is terrible for venous return and the progression of venous insufficiency.
Isn't that one of the reasons why when people are deciding where to put grandma or grandpa, they take a look at the facility and make sure they're not just in a wheelchair parked in front of a TV all day?
Right, exactly.
Give them stuff to do.
Absolutely, And for people like that, it becomes more important to, in the middle of the morning and in the middle of the afternoon that they get out of the wheelchair and maybe they lay in bed, they get the legs elevated, and just kind of help control the swelling and the repercussions of venous insufficiency. And it becomes so much more important to wear compression. That should be a part of anybody who has a lack of mobility, especially if it's someone who is in a wheelchair kind of setting for much of the day. They need compression stockings on both legs, regardless of the status of either. But
isn't it amazing what somebody's personality becomes or can change to? When somebody is miserable and depressed because they can't do anything, and they find out, oh, wait a minute, I can do this. And that's good. I can get up. That's good.
Right. Yeah, you have to, make the best of what you can. But for those people, are there things that we can do to help them? Yes. Are there more things than just compression stockings and elevation? Yeah. We evaluate those people just like anybody else. And if we find out that they have venous insufficiency that is contributing to their overall problem, we treat it if we can. If they're medically stable enough to be treated, we treat them, and with the goal of optimizing the circulation of their legs. We probably will not eliminate all of their problems, especially as it pertains to swelling, because swelling can be due to a number of different things. But if we fix their veins, is their swelling going to go away completely? Unfortunately, no. But it should improve it and hopefully make it a little easier to control and deal with, in the long run.
It's really interesting when you say that, because I saw an ad the other night, and it was an ad on migraine medicine, on migraine headaches. And they were selling the viewer on, wouldn't it be nice to have half as many of them as you have?
Yeah.
And we that don't have that condition think, no, I want them all gone.
Yeah.
Well, but if you have the condition and somebody can get rid of half of them,
right,
you're all in.
Exactly.
Where do I sign?
Sure.
Isn't that exactly what we're talking about?
Absolutely.
Here?
Yeah. If for people who have chronic swelling and all the symptoms that go along with that, if it could be half as bad, for sure.
Absolutely.
For sure. And then there are other things
half
too.
as bad means twice as good.
Yeah,
if I can go out today, if I'm not going to have a migraine headache, I can go watch my grandson play volleyball.
Yeah.
Yeah.
So, and there are other things too. I mean, not only do we treat those people with stockings and elevation, but there are other devices that we can use to kind of better the swelling. And so for those people, I guess the message is, those people need to be evaluated, and let's see if there's something that we can do to improve their quality of life.
Isn't there even a pump that you put on your whole leg?
Yeah.
And you can, you can have one at home. I mean, you can do it yourself.
Yeah, and that's another step that we take in many people. It's called sequential pneumatic compression. It's a big thing that goes over your leg. It's hooked up to an air compressor and
squeezes you.
Yeah, squeezes, and similar to graduated compression, it squeezes you from your toes going up. So it sort of helps in pushing all that fluid upward, and in the long run can be very beneficial with respect to the swelling. So what is the next question? So what are the symptoms of venous insufficiency? And we talk about this all the time.
This is a long list.
But it's worth going over because, again, there's this confusion about varicose veins being synonymous with venous insufficiency, and the two are equal, and that's that's all that you have if you have venous insufficiency, and nothing could be further from the truth. We were talking before about the fact that, and again, this bears repeating. You can literally have completely normal looking legs, and superficially, and still have significant venous insufficiency and significant symptoms
on
from
the inside.
that. Yeah. So, the most specific to venous insufficiency are achy, heavy, and tired. And usually those are symptoms that progress over the course of the day. You've been for people who have venous insufficiency and those types of symptoms, they spend the night in bed. Their legs, maybe the swelling goes away. The venous system is decompressed because they're laying down, and the blood is getting back up to the heart in a little more efficient fashion. And then they get up and the whole process starts. The valves are failing, the blood is settling down into the lower leg. We get what's called pooling, and that pooling of blood in the lower leg then creates those symptoms. So I often tell people, or I often ask people, do your legs get tired quicker than they used to? And usually people say, well, yeah, they do, but I'm getting older. And so I think that's the immediate go-to for most people, is that with a lot of the symptoms of venous insufficiency, they say, well, yeah, but, I'm getting older, and I figured it was, due to that. Well, it may not be, it may not be due to that. So if your legs, and especially if you're someone who is on your feet all day long, in your profession, and you have those symptoms, achy, heavy, tired, that that just worsen throughout the day. By the end of the day, you feel like you need to go home and elevate your legs.
I got to tell you, and I think that's great, and I always get to interrupt the doc at least once a program. And this is on, it doesn't matter what your profession is. I talked about a guy several months ago, Doc, that was a retired banker that turned into, he was a taster guy at the big box store.
Yeah.
that give people a sample of crackers all day. And believe it or not, it was very fulfilling because he got to socially interact with people. He got exercise. He had to walk around the store all day, but he had to say instead of 6 hours, he could only do it for 3.
Yeah.
Instead of 3, he could only do it for 1. And I'm actually looking at some practitioners that have every bit of experience and level. I mean, look at people in your business. Some doctors realize, okay, I'm retiring, but I'm 80. And some people say, well, I'm 50 and I got to retire because I can't stand up anymore. Mm-hmm. I'm a dentist.
Right.
Okay. Or I'm a hairdresser or I'm a whatever, you just can't stand up.
Yeah. Yeah, well, that's true. We see that all the time, and that's what you mentioned dentists. I mean, in the old days, dentists used to stand up all day long. Yeah. But as they, as the years have gone by, I mean, this is just my observation. But the chairs have changed such that you lay flat and you're much lower, and they're sitting.
Exactly.
And that's one of the reasons why that happened. I'm sure. Is just because of the wear and tear on your legs.
Well, in my guy's case, it was his back because he's been over all day.
Yeah,
and he just, geez, why didn't I figure this out? 20 years ago. It's never too late, is what we're saying here.
Right. Yeah. So, a couple of the other other symptoms of venous insufficiency: numbness and tingling. Now, those are not as specific to venous insufficiency, and I say that because numbness and tingling can be caused by other issues, musculoskeletal, neurologic, etc. But
diabetes,
diabetes, sure. But many times it can be part of the symptom complex of venous insufficiency. Superficially, again, varicose veins, spider veins, obviously that, and again, that's something that most people recognize, that, gee, I have varicose veins, I must have a vein problem. But there's many other things, like we said. Swelling. Swelling is a very, very common symptom in our patients, and in swelling is fairly specific. In that when somebody has venous insufficiency, we can say that some amount of their swelling is due to venous insufficiency.
Okay.
That much we know, but we can't always say exactly how much. So when people come in and let's say their primary complaint is swelling, I always go through this conversation, and that is that, if they have venous insufficiency, and if we're going to be recommending that procedures be done on their veins, I tell them that our expectation is that we're going to, optimize the venous circulation. So we're going to take that out of the equation. And then we'll see how much swelling is left.
Yeah, exactly. That's great. By the way, gang, if you think when we do these questions, Doc's got to explain, when you come to the office on any of the 4 islands vein clinics of Hawaii, you're going to be given the 100 questions iPad. And what it does is, it's not by process of elimination, it's by process of diagnostics. Because I think it's interesting, Doc, and you can explain that. You often have to work with several professionals to determine exactly which disease that symptoms is magnifying today. We talk a lot about you will refer people to a dermatologist and vice versa, because a lot of things look like one thing but could be another.
Sure.
And same thing with this swelling, and same thing with some of the other questions that we're asking.
Yeah.
Right?
Yeah, we interact with dermatology all the time because one of the symptoms of venous insufficiency is
skin stuff.
Yeah. Right, skin stuff. In particular, a rash that we refer to as venous eczema. Well, it looks very much like eczema of any other run-of-the-mill sort of stuff. So, we get a good number of patients that maybe have been to their dermatologist. They've been treated, it hasn't gotten better, and then they either are referred or make their way to us. So we interact with them. With respect to swelling, well, there are other reasons why people have swelling. One of the big reasons that people might have swelling is because of heart problems, cardiac functional problems. And we might interact with cardiologists back and forth. And, if we're evaluating someone for venous insufficiency and they have swelling, but maybe they have a history of heart disease, we may ask that they go see their cardiologist and be evaluated from that standpoint. And again, that will kind of help us sort out what symptoms are due to vein disease, what symptoms are due to heart disease, what symptoms are due to dermatologic problems. But yeah, we rely on other doctors all the time.
Yeah, and gang, that's why one of the neat things about Dr. Juleff is he's the medical director of Vein Clinics of Hawaii, but he actually was he's also a cardiologist. He also has performed, surgery, heart surgery. So and yet, it's interesting when you made the transition to decide this is a specialty that you're going to concentrate in, is because a lot of other things lead right back to this as the source. Mm-hmm. So isn't in some respects, you're going to be, somebody's going to send a patient to you to say, hey, doc, check this guy out. Let's talk about his veins first because we got to talk about his heart or we got to talk about something else later.
Sure. Yeah, that happens all the time.
All the time. And that's why, gang, in this day and age, it is more likely that your GP is like a quarterback and he's going to refer you out to the different specialists that you need. And that's why comparing notes, which you all can do now such more rapidly, is so encouraging for a patient.
Right. Yeah. That's what, the electronic medical record, it has become so beneficial because it's so easy to, to send information from one person to another, from one physician to another, from one provider to another. So, all of that is extremely important.
Yeah. So I get to throw another thing in here, and this is, I love this because it jogs my memory. If you have had an ultrasound on your legs, the record is kept. So that, let's say that I come in May and I have an ultrasound and I have a condition that is indicative of needing a procedure, and I have that procedure. When I come back in 6 months or so, you can look at that old one.
Oh yeah,
like boom, there it is, and you can actually see it. Mm-hmm. And then you do today's ultrasound and you say, okay, this area has not significantly changed that it needs any more attention, or look, this one's a problem. We got to treat this next.
Yeah.
Fascinating.
Yeah, we that's a big part of our follow up is doing ultrasound, and that's exactly what we do. Absolutely, we compare everything to prior ultrasounds and see where the patient has been, what have we done to them, where are they now, and kind of continue in their treatment plan. So so that's a very beneficial way to do that.
Yep, hip for iPads.
Yeah,
because they help you a lot.
Yeah. So another symptom is muscle cramping, and here again, most people don't necessarily know that muscle cramping can be a symptom of venous insufficiency, and that's a symptom that we see all the time. I at least in my experience, I particularly see that in the older age group patients, and it can be terrible because cramping of the legs in the middle of the night is so disruptive, and we have so many patients that come in and say, I can my legs can cramp 2 or 3 times in the night.
Isn't it amazing, Doc, how incredibly painful it is for some people. And they have no way to make it go away. They say, well, you grab your toe, pull it up. Nope, sometimes that makes it worse. Mm-hmm. Or point your toe down. Whoops, that makes it worse.
Yeah.
I think a lot of people just try to grit and bear it, and it's pretty debilitating, pretty awful.
It can be debilitating because at the very least it's interrupting your sleep several times a night, and then again, especially in the older age group who aren't as mobile as you are when you're younger. Even if they have to get up and walk. I mean, many people will, if they get a cramp in their leg and it won't go away, they get up and walk. Well,
they'll try to get up and walk,
or try.
Oh, I can't get up. Yeah.
And and that becomes even more disruptive to their sleep pattern, and so it can really again in the end impact their quality of life so tremendously, and we hear that all the time. I mean, we treat these people, the muscle cramping goes away, and they're happy. They're very happy.
Well, when you mentioned that, it made me think right away of there's more than one reason you get those cramps. Mm-hmm. So that's why, once again, the interaction between the specialist or having somebody in the middle saying, okay, stop all you guys, this guy's got this, or this lady's got this, we think.
Yeah, there are other reasons, and I guess the one big thing is dehydration.
Yeah.
So we always make sure that our patients are in tune with that, maintaining good hydration. And then, mineral supplementation, particularly magnesium. Usually I'll put all these people on a magnesium supplement, and that helps a little bit. But still, some amount of their muscle cramping may be due to venous insufficiency if they have it. And so we treat that as we need to. Restless leg syndrome is another thing that many people don't necessarily attach to venous insufficiency or vein problems. Restless leg syndrome means a lot of different things, but basically what it boils down to is that a person will find that they are either consciously or subconsciously or unconsciously moving their legs when they're awake or whatever, or many people notice it when they first go to bed at night. They'll feel like they have to move their legs a lot in order to get the legs comfortable. And what they're doing there is that they're eliciting that calf muscle pump activity, and because when you're again using that muscle, and it's facilitating blood flow and alleviating some of that pressure and pooling of blood in the leg. At its extreme, the extreme of restless leg syndrome, it's something else that will actually interrupt sleep in the middle of the night. People will have like unconscious type of movement of their legs. And again, the leg is reacting to that increased pressure and pooling, and it can actually be disruptive to sleep. But I think most people, it's not that extreme. It's just that they find that they have to be moving their legs a lot. I know one lady I remember from a number of years ago. She said, when I go home at night after work, I can't even sit down because the minute I sit down, I feel like I've got to be moving my legs. And she said, rather than just walk or sit there and be symptomatic or whatever, she would iron at the end of the day and remain in an upright position and walking.
And this is no laughing matter, by the way, but I do have this lady named Claudia that thanked me and said that she was listening to the program and was hearing us talking about restless leg syndrome. She says, my husband's got that. No matter where we go, we're sitting at the table and his leg is shaking. It shakes when he drives, it shakes in bed, it shakes all over the place. That's not restless leg syndrome.
No, that's nervous leg syndrome.
Nervous leg syndrome. And isn't it amazing? And particularly you see it now among youngsters. Yeah. Because they're sitting there on their thumbs in their video games. Right. And they're just shaking like like they're jogging. Is there a lot of confusion about that as a symptom?
Yeah, there is a little bit of confusion because some people when I ask about that symptom, restless leg syndrome, then they'll demonstrate.
Oh yeah,
I do it like this, and I said, well, that's not really restless leg, but it's funny, nervous leg. So anyway, so the next another symptom we talked about already, rash and itching. I mean, that's something that people don't necessarily attach to venous insufficiency, and like I said, we get many people referred from dermatologists. Darkening and discoloration of the lower leg is something also that people have, and they don't necessarily associate with venous insufficiency.
This is a big lesson here. This is a big one.
So I every chance I get, I repeat that if you have darkening, discoloration, abnormal appearance of the skin, is it becoming thickened, irregular, then there's probably some venous insufficiency. And I just wanted to close with this. When should I see a doctor for my varicose veins? And I spotted this quote somewhere, and I thought it was very good. And it goes like this: even without visible varicose veins or spider veins, you may be suffering from venous insufficiency if you are experiencing fatigue, heaviness of the legs, itchy legs, aching of the legs, restless legs, skin color changes in the legs, night cramps, bleeding, or ulcers of the legs, all the things that we talked about today.
And I was going to say, when you pile them up, when you get several of those layered on top of one another,
Yeah.
bingo, you got an answer here.
Exactly, yeah. So these symptoms typically get worse as the day progresses and are relieved somewhat by elevating your legs and aerobic activity. So, that kind of sums up what we've talked about today. And if you have any of those symptoms, come see us. We'll figure it out.
And by the way, getting yourself an examination is painless. Social distancing. If you have an appointment at 2 o'clock at Vein Clinics, it's at 2 o'clock when you see them. It's all good stuff. So remember that and tell everybody else about it. And if you want to know more, I'd like you to go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com. And Dr. Juleff and his staff on 4 of our islands will take you and get you treated properly. And if you have a question, you might want to just get in and on the contact us and get it. We'll get you on one of our 20 question shows down the road next time. So for this time, though, thank you very much for listening. And remember, healthy veins, healthy legs. And if that's what you want, you got to check out Vein Clinics of Hawaii at veinclinicsofhawaii.com.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.